Today we're going to be talking about COVID anxiety and one technique you can try if you're experiencing excessive anxiety about COVID. Hi everyone. In today's video we're going to be talking about COVID-related anxiety and one tip or one technique and tool that you can use if you're finding that you're experiencing excessive or difficult to control anxiety around COVID. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. Now, with those things out of the way, let's start talking about COVID anxiety. Now, one of the things that the COVID pandemic has done is that it's really disrupted our sense of safety and security in the world. How do we evaluate what's safe now? Because people are dangerous. Shopping is dangerous. Being around groups of people are dangerous. Sniffles and cold symptoms are dangerous. The COVID pandemic has really disrupted our sense of safety and security and has led to what we used to view as being perfectly safe now being highly dangerous and highly risky. And that's one of the things that's happened, is that our understanding of risk and threat has been skewed by the pandemic. And what can happen with excessive anxiety around COVID is that we can tend to overestimate the risk or the danger associated with COVID. And this has led to a lot of anxiety for people, a lot of anxiety about not just getting COVID, but also transmitting COVID to other people. And so I've seen both of these happen, where I've seen people are really afraid for themselves that they might experience or they might contract COVID, but also real concerns about transmitting COVID to a loved one and inadvertently making other people sick. So the question is, how do we manage? How do we manage this anxiety if we're experiencing excessive, difficult to control anxiety about COVID? What can we do about it? And so what I'm going to be talking about in today's video is one cognitive tool that can help with this COVID anxiety, and it relates to something called probability estimations. And really what probability estimations are is they help us develop a better understanding of the actual risk and allows us to evaluate or determine to what extent our perception of risk is reasonable or real, and to what extent our perception of risk is dangerous or excessive. Now, the key thing I want to point out here is that this is not to say that COVID should be taken lightly. This is not to say that people shouldn't be anxious or shouldn't be concerned about contracting COVID, shouldn't be concerned about spreading it to other people. So this isn't about saying you shouldn't be anxious about COVID, but really what we're talking about in this video is more about excessive anxiety and how to determine if you're experiencing excessive or unreasonable levels of anxiety, and if you are, what you might be able to do about it. So I had a really good example of this type of COVID anxiety that we're talking about with a client that I was working with a few months ago. And this client was really anxious and afraid to go to his workplace, despite the fact that he had had his first vaccine shot. And his real concern was that he was going to go to the office, he was going to be in the office, and that he was going to contract COVID and bring it home and infect his children. So we started talking about his anxiety, and we started talking about probability estimates and how he can try to be thinking about the risk or trying to determine whether or not his perception of risk was accurate. So with probability estimates, there's a few steps. And the first step is to determine the actual fear that the person is worried about. Well, what is it that you're actually afraid is going to happen? Now, in the case of my client, he started out by saying, well, his big concern was that he was going to contract COVID at work, at the office, and bring it home, and that his children would get it. But then I asked him the question, okay, well, are you concerned that your children will get COVID and have relatively mild symptoms or be relatively asymptomatic? And he clarified, no, that wasn't his concern. His concern was that his children were going to get really sick or die if he were to go to the workplace, contract COVID, and bring it home. So that's the first step in probability estimates, is to determine and clarify what exactly the actual fear is. So once you have that fear, once you know exactly what it is that you're afraid of, I always like to ask people, okay, what's the likelihood? Give me a prediction of the percentage likelihood that this feared outcome, this terrible outcome, would actually take place. And I always ask for a very conservative estimate. Give me the most conservative estimate you can give. And in my client's case, he predicted that there was a 5% chance that if he were to go to the office, he would contract COVID, bring it home, his children would get sick, and that they'd get really sick and potentially die. So that was his prediction. That was his probability estimate of the likelihood that this could happen. So once we have that probability estimate, once we have that prediction, the next step is to think about all of the events and all of the things that would need to take place for that feared outcome to happen. And for each of these steps, to think about the individual percentages that each of these steps, the likelihood of each of these steps. And when I talk with my clients about this, I always ask them with these individual percentages to be very liberal in terms of determining what their percentage is. So if they're thinking it could be anywhere from 10 to 20%, I always tell them lean on the side of being more liberal. In other words, the likelihood of this happening is more likely than not. So if it's 10 to 20%, let's pick 20%. So I got my client to think about all of the steps that would need to happen for that feared outcome to occur. So one thing that would happen is that he'd have to be at work in his office, and that someone would come into his office and start talking to him. And so at his office, they have rules about, try to limit interactions with other people as much as possible unless you need to for work. But he said he's got a pretty chatty office, or a few chatty office mates, and so he estimated that it was a 75% chance that a coworker would come into his office and start talking to him. And so the next step, the next thing that would have to happen is that the person would not be wearing a mask, or would not be physically distant, or would stay in the office for a really long time and be talking at my client and not pick up on my client's discomfort about how long this conversation was going or how close the person was to my client. So my client's prediction of that happening was about 15%. So the office has rules, but there's a few people that might break those rules. So what would be the next thing that would happen? Well, the person would have to be infected with COVID, but asymptomatic. I mean, presumably the person's not showing up to the workplace openly symptomatic with COVID symptoms like coughing or having difficulty breathing or fever. So the person would have to be asymptomatic, but they would have to be infected with COVID. And so my client estimated that this was 5%. The next thing that would have to happen is this coworker's talking to my client, and the coworker is shedding COVID virus, and that my client would have to inhale or breathe in some of that COVID virus. And so my client's estimate was that this was an 80% likelihood that would happen. If the coworker was there, if the coworker was infected, and they were breathing in the office, there's an 80% chance my client would breathe in the COVID virus. Then the next thing that would have to happen is that my client would have to become infected with COVID. Now, for this estimate, we actually had some data to go by, and the research that shows that after one shot of the vaccine, that a person has about 80% protection, 80% likelihood that if they're exposed to COVID, that they won't get infected. And so my client had his shot a number of weeks earlier, and so his likelihood, the probability that he would become infected in this scenario, he was able to determine would be 20%. So the next thing that would have to happen is that my client would have to go home and infect his children with COVID. And so he predicted that if all of these steps were to happen, it would be 100% likelihood that he would infect his children with COVID. That there was no chance that if he got it, if he was infected with it, there was no probability that he wouldn't be passing it on to his children. And so again, we're going with very liberal estimates, so I don't argue with the clients. This isn't about trying to determine whether or not these probabilities are reasonable or excessive. It's just I want the client to be as liberal as possible. So if he felt that it was 100% likelihood, then that's fine. 100% likelihood it is. And so then the last thing that would have to happen is that his children would have to become extremely sick or die or have long-term effects of getting COVID from their dad. And so his prediction of this happening is that it would be a 5% likelihood that that would occur. Again, not arguing the probabilities or what the statistics say, that's how he felt. So it's a 5% likelihood. So now we have this list. We have this list of all of the things that would have to happen and probabilities of each of those steps happening. Now, the key point to understand is that every single one of those things must happen in order for the feared outcome to occur. So, for example, if the coworker doesn't happen to have COVID or isn't infected with COVID, the feared outcome isn't going to happen. If the coworker doesn't enter my client's office, the feared outcome isn't going to happen. If my client doesn't inhale the COVID virus, the feared outcome will not happen. So every single one of those steps must take place in order for that catastrophic feared outcome to occur. And so the way to calculate the percentage is to multiply all of these percentages together to determine what the cumulative percentage or the actual likelihood would be. And in this case, with my client, the cumulative percentage of all of these things happening was 0.0045 of 1%, or less than 1 in 20,000. So that's the cumulative percentage, and that's cumulative likelihood. And so what we do then is then compare what this cumulative percentage is to what the predicted percentage was. So remember, my client predicted that the likelihood of him going to work, getting infected and coming home and bringing that infection home to his children and making them really sick or them potentially dying, he predicted that it was a 5% chance, which is 1 in 20. But when we looked at these cumulative percentages, the actual percentage based on his prediction of all of these things happening was 0.0045 of 1%, which is less than 1 in 20,000. And so what this means is that my client was overestimating the likelihood of the bad thing happening by over 1,000 times. So he was viewing more threat than was actually there. He was overestimating the threat by over 1,000. And so by doing this probability estimate, what he's able to recognize is that his fear was excessive. So at a 1 in 20 chance, a 95% or a 5% chance of him bringing COVID home and making his children really sick or them dying, that's a really dangerous risk. And in that scenario, it makes a lot of sense for my client to be avoiding the office, because a 1 in 20 chance is that's a fair likelihood that it could happen. But at a less than 1 in 20,000 chance, then it doesn't seem to make as much sense for my client to be avoiding the office, because it's not nearly as dangerous as he anticipated or thought it actually was. And so by doing this probability estimate, what you can do is to get a sense of whether or not your fears are reasonable. And in the case of my client, he was able to recognize that his fears weren't reasonable. His fears about COVID were excessive or disproportionate to what was actually going on. Now, this is only the first step. So once he was able to recognize that, then he felt a little bit less anxious. He saw a little bit less fear or threat associated with going to work. And that allowed him to then engage in exposure to the office. And so we were able to get him to start slowly working his way back into going to the office. And what he found was that as he was going to the office more, he was getting less and less anxious about going to the office. But interestingly enough, he also recognized that a lot of his predictions about what was going to happen if he was at the office weren't really coming true either. So coworkers weren't stopping by his office a lot, unmasked, ignoring physical distancing rules, talking at him. There weren't outbreaks at work. There weren't a lot of people who were coming to work who were getting tested or testing positive for COVID. So he was able to start returning to work because he had done these probability estimates, and by going to work and doing exposure, his anxiety gradually went down. And so within a month or two, he was feeling a lot less anxious about COVID and was feeling a lot more comfortable at the office. So this is how you can use probability estimates to determine whether or not your level of anxiety about COVID is reasonable or realistic, or if it's excessive or disproportionate. And if it's disproportionate, what you can then do is maybe start engaging in some of those activities that you might be avoiding because you perceive that they're more risky or more dangerous than they actually are. So I hope that makes sense. I would love to hear your thoughts and ideas about this. So please leave me some comments in the comments section down below. I read all of the comments and try to respond to as many of them as I can. If you're enjoying my videos and would like to see more, please hit that subscribe button and notification bell, and you'll be alerted every week when I post a new video. So that's it for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.